I'm Liz Mazzell, so I'm the co-chair of Annie's Research Work Group. So I just wanted to talk about our CEs really fast, and then we'll get into our presentation with Dr. Larson. So with our CEs, you should receive an email from Hannah within the week, and it'll have a link to today's recording and presentation. And it'll also include an evaluation and a post-test for you to take. So if you don't do that within the week, you'll have to rewatch the lecture, which isn't a bad thing. But you have to rewatch the whole thing and then take the test. So you can do that at a later time if you need to. All right, so today's presenter, I'm very excited to introduce you. She's an important mentor of mine. This is Dr. Kim Larson. And she did receive her PhD in nursing and Master of Public Health and Nursing from UNC Chapel Hill. And she is a full professor at East Carolina University College of Nursing, which is in Greenville, North Carolina. And she has a strong research history in Latino health, and that includes research and service in Guatemala. So her title of her talk today is Safe Drinking Water Study in Guatemala. And you'll just tell me whenever you'd like to advance, and I'll advance the slide.
Okay, go ahead. Let's. Okay, it said the host muted me, but I don't think that you meant to unmute me. Okay, the objectives is the next slide, and I am hoping that you go away with an understanding of this fairly unique research methodology to be used in a community engagement project in Guatemala. I'm hoping that you'll at least identify 3 characteristics of this community university partnership that really worked hard to improve public health in these areas. And then one strategy that may promote long-term sustainability. Liz? So a little background, millions of children die each year from diarrheal disease secondary to contaminated water. They're in Guatemala. We don't drink the water from the tap. We buy bottled water. And that can be very expensive for people living there. And so we got into a water filter project. But Guatemala has the highest child mortality rates in Central America. And when we learned that the 2030 United Nations Sustainable Development Goal was directly trying to address safe drinking water, it made us want to help out with that. So goal 3 is health and well-being of all people. And goal 6 is safe drinking water by 2030. And so we have 10 years. No, we have 8 years now to do that. Let's go on. I don't know if everybody is familiar with the United Nations Sustainable Development Goals, but if you do any international work, it should be connected with one of these. And I know Lisa is doing an air quality, and as you can see, air quality is one of those. So, you know, I think to be ethical, and we're going to talk a little bit about ethics. Those of us in developed countries are really responsible for following the United Nations Sustainable Development Goals for developing countries. So we don't need to be doing anything that's not linked with one of these 17 goals. And pretty much they cover everything. Next slide, Liz. I couldn't do this work unless I had been a Peace Corps nurse in Honduras, where I became fluent in Spanish. And so my work in Guatemala is in Spanish. And then later I came back from the Peace Corps and worked in a migrant health center in North Carolina with immigrants, mostly from Central America and Mexico. In 2008, we started this partnership with La Unión Centro Lingüístico, the director of whom used to work with the Peace Corps. The Peace Corps, so this course is modeled after the Peace Corps, which if you don't learn the language of the country, then you go back home. That's the motto of the Peace Corps. So if you don't learn Swahili and you're in Africa, you go back to the United States. So in Honduras, you learn Spanish or you went back home. Most of us stayed for 2 years. The Peace Corps is a 2-year commitment. So it's modeled after the Peace Corps. It's language and service learning. And it's 3 courses in the summer. Students, the service learning that we participate in are oral hygiene, oral health, nutrition, and hand hygiene. And so we started this in 2008, and I just wanted to let you see a couple of the groups that we've taken. On average, we take 12 students. 1 year we took 18 because it is a very popular course. At ECU, we only have 2 study abroad courses for undergraduate nursing students, which is terrible. And I'm disappointed, but you know, it's very difficult to take students abroad. And so that difficulty translates into faculty not being able to do it very easily. So we'll go to the next slide. So a little bit before we get into the study itself is global outreach. As you know, as a Peace Corps nurse, I really did outreach in Honduras, but it wasn't short term. It was long term. It was 2 years. The Peace Corps told you that the first year you're going to learn from the people, and the second year is when you may accomplish something. Okay, so 2 years, long term, and you know, many study abroads are 1 semester. So these are the ones that I take students on because they're nursing students and they have other commitments, are 3 weeks. And there's controversy in a 3-week study abroad. There are people who don't believe that you can learn anything in 3 weeks, and or give anything in 3 weeks. So I looked up, these are 2 articles that I highly recommend to anybody who wants to challenge that, but I mean, you got to meet the challenge. And so DeCamp, you know, says that short-term programs all over the United States, you know, have health professionals going to different countries, Africa, Central America, with medical supplies, which include medications and educational materials. And this controversy has a lot to do with, you know, we're providing clinical care, but are we evaluating whether we're doing any good or are we doing more harm? And so if you answer that question with, you know, are you doing any good? You have to then evaluate what you're doing. Sorry, just 1 minute, Liz. So I have an example of mebendazole. So medications go down, either they buy, you know, medical professionals buy them in the country or they bring them from the United States. But so we find a parasitic infection and we give free mebendazole. But should we really be looking at upstream ideas and trying to provide water filters for contaminated drinking water? So that's really the question that you have to answer before you do one of these short-term outreach, because some medication, and especially vitamins, this is a real problem. Gummy vitamins can be looked at like candy unless they're very well, you know, put high up and out of reach of children. And so, you know, you really have to talk to families about where they store their medicines, and sometimes there aren't medicine cabinets. So anyway, there's a lot of ethical considerations. So the next slide talks about how to ensure that you have a sustainable short-term outreach. And there's these guiding principles that SUCHDEV insists that if you put these in place, you'll have an ethical program. So the common purpose between the partners in the country and the US partners, they need to have a common purpose, such as you need to be working on the same health issues, the same underserved communities. There needs to be a local organization to collaborate with. So a US mission shouldn't go down alone. They should be working with an organization that's local, that both sides are learning from each other. So there's co-learning, and that's a hallmark principle of community-based participatory research. That the outreach is doing a service that the community wants, that there's teamwork. So we go down with a cadre of nurses, but we work with a Guatemalan physician. There are studies where physicians and nurses go down from the United States, and the nationals in that country later often just prefer American doctors and don't seek out local physicians. And so that's something to keep in mind. You want your outreach to be sustainable, and it will be if someone is local there that you're working with. And finally, were goals met? That's the evaluation piece. So I mentioned that we started going down to Guatemala in 2008. But initially, we were just learning about, you can turn the slides, Liz. We were just really learning about the area for the longest time, and what what the communities wanted us to do. And they wanted us to do those three things: health promotion on oral hygiene, or hand hygiene, infection control, and nutrition. But as I mentioned before, we were treating parasitic infections, and it was about 2015 that the pediatrician we were working with said, these people need filtered water, because they were taking their water from this lake and drinking it. And this lake is, being used for personal hygiene as well as washing clothes. So all over the world, nonprofit organizations provide water filters in developing countries. I mean, there are also nonprofits that are digging wells in places where you can dig a well. Where we go, it's on the side of a volcano, and you can't dig a well there. And so, but there are rivers and lakes, and so that's where they're getting their water from. So in 2015, the College of Nursing that I work for at ECU distributed water filters in one village. And we went back 1 year later and asked about household health and diarrheal cases at that time. And we also looked for water filters. And this is 1 year later, 71% of the water filters we had distributed were still working. This was a major disappointment to our team, but not to the Guatemalan partners. They thought if one was working, they were delighted. But we did look into the literature more, and sustainability of public health initiatives is really understudied. So now I'm going to get into the study that we're talking about today. The purpose of this current study on community engagement was to better understand how community engagement through a monetary contribution might sustain safe drinking water in Guatemala. So the methodology is a natural quasi-experimental design, and I think that's unique maybe for the participants on this webinar. It was unique to me. It could only have been done if we had evaluated our first study. So the natural part of this methodology is that we had a village before that had no community engagement. They didn't pay for their water filter, and community engagement was defined by the director of the other communities. she said that community engagement would bring dignity and ownership to the families. Now, it was a $5 donation. Water filters are $35. And so our philanthropic organization paid the $30, and the participants in this study paid $5 for their water filter. But this was all, you know, the leaders of these villages, you know, said, let's have them contribute a donation. So we did the same thing in both areas. So, you know, we've got one in 2015 where they got a free water filter, but they had all the same, you know, we taught how to take care and how to use and how to change the filter every 2 years. Then we had so that they were called the comparison group, and then we had the intervention group that paid the money. So this cultural immersion program has been going on for 12 years. Over 150 students have gone on this program. We provide scholarships for study abroad students and get a lot of grants and donations for our projects. Next slide, Liz. So once again, the comparison group was that first group, and this is the leader of that village. It was one village, and there were 71 households in that control group. The subsequent group was the community engagement group. They're the ones that paid a $5 donation, and it was 3 villages, a total of 40 households. These were much smaller villages, and 1 leader. So notice the time frame. I want to point this out. There were 4 years difference between the two, you know, the two groups, and the reviewers of this manuscript before it was published asked us, could time have made a difference? And so I had to go back and look at what happened to the country during 2014 through 2018, and I'll talk about that in a minute. But that was a good question. Okay, next slide. So the intervention was an educational session. Both groups got the educational session, and both groups got a water filter. 2014, no cost for the water filter, and 2018, $5.50 to be exact. I've been saying $5, but $5.50. This is one of the ECU students and one of the families that we received permission to use her beautiful face and daughter. Next slide. So in both groups, we went back 1 year later. I was the same PI. We had different students because they graduated. We gave the same 13-item survey that had variables about family health and water filter use. And we gave every family the same food package. And there it lies on the table. So, okay, remember, these are 4 years apart, but we gave them the same thing. So a little bit about descriptive statistics. Well, we did descriptive statistics for both groups, and then we did a multivariable logistic regression on both groups. So, and we distributed the water filters in this pickup truck. Okay, you can turn to the next slide, Liz. So descriptively, there were some differences. The 2014, 2015 group had fewer adults in the household than the 2018, 2019 group. So just notice the 2018, 2019 group had more adults per household. In 2014, 2015, that group had more children in the household. And then finally, in 2018, 2019, there were a vast majority of the water filters were working 1 year later. So remember, we distributed the water filters in 18 and went back in 19. And it was the same time period too. We go every May. So that's important as well. And it was the same time period in 2014. We went in May, the month of May. The 56 and 71, remember I said there were 71 households that got a water filter, but when we went back in 2015, we could only find 56 of the 71 families, okay? And when we went back for the CE cohort, when we went back, we found most of the families. They were less scattered. They were living closer together. Okay, next slide, please. So the multivariable logistic regression is what really told us that the CE group was the only predictor for having a working water filter. There were about 5 times higher odds of having a working water filter in the CE group when we put in number of adults per household, number of children per household, working adults, and flooring type. So, according to this multivariable logistic regression, the CE strategy explained the variance in the working water filter status. So the discussion. So we feel like the CBPR, the community-based participatory research framework, was valuable. We couldn't have done this in those villages without a leader in the village. One of the leaders may have been a stronger leader than the other. We could not tell, but we noticed the personality of so remember the leader in the village with me? There was a man in that one village, and the leader in the 3 villages was this woman on the ground in the middle. And that kind of depicts how she worked. She was sort of on the ground with the kids and the families. I'm not even positive if she didn't, whenever she ran into him in the grocery store or the market, didn't ask him how the water filter was doing. She never said that to me, but had that kind of personality. She genuinely cared about, not that the male leader didn't, but he was working a lot more outside of the families. So the villages were similar, but there was a major time lapse that I've been mentioning the last few minutes. But I looked into the literature, and there was no major natural disaster in Guatemala in those years, which is amazing because they have 29 active volcanoes. And they also have 2 oceans, the Pacific and the Atlantic. They border Guatemala. So there was no hurricane even in those 4 years. And the economy didn't change. I went every year. I went in 15, 16, 17, and 18. I can tell you, the quetzal was the same. It's 7.5. It's still 7.5 quetzals to the dollar. It still is that right now. So the economy didn't change. I was able to say in this article that there was no change in 4 years. So it wasn't because there was a major time lapse in the groups. So the implications for future research is we need to hear from participants, and Liz would laugh at this because I'm a qualitative researcher, but this CE strategy required a survey. We had to find out some survey items, but it's really truly needed to be a mixed method study because we really need to ask people what they think about the $5 donation. And why they think their water filters are still working 92% after a year, And we need to go back to that other village and ask those participants. And so we haven't interviewed, and that will be our next step, to interview participants to inform this survey. And then, you know, really the bottom line is that we need to keep on working with our partners in developing countries so that we meet the United Nations Sustainable Development Goals by 2030. My last slide is, I always tell students this, that whatever you do will be insignificant, but it's important that you do it. You know, I think we have a tendency to think that, you know, handing out water filters tends to improve everyone's health, and it doesn't always. It's a behavior change, just like eating right, not drinking too much, not smoking. I mean, all that is a behavior change, and we do it one person at a time. That's my public health nurse in me. The next slide are some references for you, and I'd be happy to answer any questions. Now, I probably went too fast, but I see that there are 12 people on here. I would love to answer your questions more than talk.
Maybe you could stop the share and then we could have like a gallery.
Okay, great.
Okay, great.
Thank you, Lisa. Yeah.
Yeah. Does anybody have any questions that they want to ask?
Hi, Anne.
Hi, I'm a pediatric nurse practitioner and I'm really interested in community-based health. I'm basically retired at this point and volunteering in the community. And I noticed that a lot of primary prevention opportunities are missed locally in our own country because we're not doing community-based work. I'm wondering if you can comment about that.
Oh, that is a great question. And I really believe in the lay health advisor model. And so most of my research in the United States and specifically in North Carolina is with community health workers, lay health advisors. I truly believe that we need that work, that the people who relate better to populations that white nurses don't necessarily you know, meet the needs of. Even with Spanish language skills, I'm an outsider. I don't try to make, you know, myself an insider. I am an outsider, but I work alongside Michelle Estrada. I publish, you know, I make sure that they want to be a part of the team. That means they have to take those darn city modules, but they're in Spanish and a lot of other, you know, the city modules are the ethical modules that you have to take if you look at data. And so I really, and Liz knows this, that Liz had a partner in the community, a farm worker who took those, and you can take them alongside a friend. It's, you know, I think that it's good to take those city modules. They need to know that we have ethical standards that when we do research. And unfortunately, there are gaps in those ethical standards sometimes, even with those modules. But yeah, I mean, I think that that's the answer. And to our community-based, we need more people doing work with people in the community who speak the language and live the experience of unfortunately, the marginalized populations that we have, our immigrant population and soon to be Ukrainian population. Jessica?
Yeah, I'm like itching to talk, but I'm like, I don't know where to start. I love, I guess I'll just share that my first outreach trip, global outreach trip, was in Quetzaltenango in Guatemala. And I worked with an organization called Hospitals of Hope. And we were it's about 3 hours outside of Guatemala City, in a very rural community. I mean, they had no hospitals. It was the first time I ever saw like a glass syringe and glass IV, but I mean, it was an amazing experience, the people that came through. And I did a lot of the triaging because back then my Spanish was very good. So I love the population, the community. I feel it. I am planning a trip to Peru with my nursing students in July. And I guess my two questions are, one, would this be something that could be replicable in that arena? And two, how what was the pre-work before you got there? Did you have like a college or university you were participating with there that sort of gave you that on the ground support in order to kind of progress with this? Because I definitely don't want that like savior mentality of I'm going to come and change your world. But I do think that that support is really needed. We went to Greece 2 summers ago, and we worked with refugee populations there. With I had an interprofessional group of students coming with me, so it was very hard to do without that on the ground support.
Yeah, we had a contact in Guatemala, and at this Centro Linguístico, we knew we wanted the students to improve their Spanish. Some go, we've taken Colombian and Mexican students who had perfect Spanish. They couldn't write it. They grew up in the United States, and so they spoke it to their mom and dad, grandpa and grandma, but they couldn't write it. And so they learned a different kind. They learned the written Spanish, but everyone, so a Spanish language, I think we found a Spanish language organization that also had a social service arm on it, which was really, I think, unique. And so because they had a social service arm, they were laying concrete floors for families who had dirt floors. And we did that once. And then we thought our nursing skills would be better in schools, public schools. And we talked about this. We said, what do you think? Our nursing skills, we know a lot about health promotion, disease prevention. And so the engineers took there were engineers from NC State University. So we weren't competing with these service learning projects. We were using our different skills at different places. So we just took off into the public school system. We were very lucky. Public transportation was easy. It's a very reasonable amount of money. It's $1,800 for 3 weeks in Guatemala. I know Lisa knows that Guatemala is very reasonable. Now the airfare has ranged from $400 to $900, and that's always different. This year it was $600. But students line up. I have to tell students that I can't take any more because it's so reasonable. You go to Africa and it's $4,000. You go to Australia, it's $4,000, and you go to so because I don't use a travel agent, I communicate with La Union. So I think that's part of an issue too for our students going abroad, the cost.
Yeah. Thank you so much.
Thank you. Thank you for coming.
I put in the chat the link to the filters that you use, the Eco Filtros. Which I brought one back from the US, the metal one, and everybody that comes over wants one. They come in a really big size, but I brought back kind of the personal size one. And it's great. It filters, it's a ceramic base. The ceramic part filters out all the bacteria. And I've seen these used in houses in Guatemala, and we have them in our project office, and everyone uses them because you can just put that whatever water in there and it filters through this silver ceramic and just eliminates the bacteria. So EcoFiltro is a really great organization, and it's made in Guatemala, which is another neat thing.
That's right. We support the Guatemalan company. They give us, we go down there and buy hundreds of dollars of, I mean, and so they give us it at cost, the filters. They take US dollars, so I don't have to change hundreds of dollars into quetzals. What was I going to say? Oh, and every 2 years you have to take that clay, silver impregnated clay pot out, and they make beautiful fences. They pile, just like bricks, they pile those pots on top of each other,
Wow.
and you can see these beautiful fences in between yards, you know, plants are coming out of them, and it's really,
Oh.
so they recycle the old water filter.
Oh,
Which is
yeah,
great.
that's great. I didn't know that. Yeah. Any other questions?
You've got a nice cat.
No,
Lisa.
actually, it's a dog.
Oh, oh my God.
It's a dog with cat-like ears. But yeah, she's my rescue animal.
Lovely.
Yeah, so I just wanted to say it's really great that you've gotten your student nurses to be so enthusiastic. At Emory, we have the Lillian Carter Center for Social Responsibility, and our students have to participate in the service learning. Oh, she's coughing now. Allergies, pollen. She's making a weird noise. So anyway, I'll just keep talking. And they have to do their service learning trips. And they've taken students to Guatemala and also to Peru, to Cusco. And yeah, those are very popular trips because a lot of people have that Spanish language skill. And I think it's great you've incorporated research into it, because that's something that a lot of times it's just, they just go and see some clinical thing and go, oh, okay, I did a bunch of pap smears, now I'll go home. But it's not really
Yeah.
what you want them to get.
That's why I brought up those two, you know, I mean, it was really something that made me stop and think too, when I read those two articles about outreach, that I think we had better evaluate what we're doing in some way, you know. I mean, it can be IRB research, but it also could be a quality improvement project. But there should be some component of evaluation. And we always didn't do that. And I know in the Peace Corps, I didn't do that. And the Peace Corps didn't tell me to do that. And I was 22. So, you know, I think we have to be like, now it's important to evaluate what we're doing to see if there is a benefit. And hopefully there's no harm.
Right. Yeah. My study that I'm doing now started with cook stoves, and now we're looking at reducing plastic waste burning, is an implementation science study. So the first year was just formative research to figure out what are the enablers and barriers to you know, people are inundated with plastic trash. What do we do with it? There's no garbage truck, we burn it. That's what we do. And so thinking, how can we change that model? You know, because they don't want to burn it. They know it's bad. You know, I've heard that for years, but they don't have another model. And so working with Guatemalans to understand the context and how they think it could be addressed is a good model. I think a lot of the communities that we work with feel pretty cut off from the Guatemalan government. They feel like the Guatemalan government is corrupt and doesn't support them. So we don't expect anything from the government. We just take care of ourselves. And then there are a lot of people that come in from the United States to do these health projects. And there's another, you know, issue there of trust and who are these people coming in.
Yeah.
That's why, I mean, I've chosen one area where I worked for 10 years and just moved to another area where I've been 5 years, because I'd rather have deep learning in a small area than just doing global health projects to publish papers, right? It's not going to change anything.
I so agree. I think that deep knowledge and trust is critical to making any change. And, you know, these last 2 years, I don't know about you, but, you know, we haven't been there. And, you know, going in a couple of weeks, it's just going to be very interesting to see, if that trust is still there, and, or if we have to build it again.
Any other comments or questions? We have a lot of silent listeners.
Dr. Larson, I know you haven't done you spoke about like a focus group, like your next project. I know you haven't done that yet. Are you willing to discuss why you think the CE group had more functioning filters, or would you rather wait until you actually conduct the research?
Well, I'm gonna agree with the director or the leader of that village. And I'm gonna say that I think that a monetary, and I've heard this from there's just a few other articles on monetary contributions. And so I really think that it gave them ownership of, and she says dignity when you are able to pay a little bit for something. Now, all of these families also, they needed a lot of other things too. I mean, they needed food, and they needed a cook stove, and they needed, many other things, maybe a concrete floor. So, it's really hard to say without asking them. I mean, I really like to hear the voices of participants, but it was the director who said she knows them well enough to know that they want to contribute and don't want, they couldn't afford a $35 water filter, but she felt that they could afford a $5 water filter. I don't know. There's another Jessica. Do you have a question?
I so appreciate this talk and your commitment and expertise. Thank you. No, I think what resonated with me throughout was the match with the community desire for the intervention. And, with anything implementation science, addressing that reach and that adoption, any strategies or lessons learned for people going into new communities as to what worked, what sort of hidden barriers did you hit, or has your team hit where it just wasn't a priority for the households?
Yeah. I mean, if households don't have, any income at all, so then we're talking desperate. As a public health nurse, I immediately see if there's organizations that are giving out food. I mean, we have the WIC program for our low-income mothers and children, and I learned that in Guatemala there's a similar, it's not called WIC, but there's a food program for women and children. So I think I'm going to say to you, the best thing to do is an assessment of that village, and the village will help you. Here are, our assets. I always go, what is great about this village? Tell me what is great, because there's something great about every place. Even Goldsboro, North Carolina, which I know you've never heard of. That's where I come from. And anyway, so I always start with what's great about your village, and then what are the problems? And that's one of the first things we did. We did a needs assessment. And as nurses, that's what we do. And so you do it side by side with the community, and just talk, go to forums. And so they see that right away you want their input. And I'll be honest with you, I've had mothers in Guatemala say, no one's ever asked me for my opinion. Well, we've had women here in North Carolina say that, I just get we're not very good. I mean, we're great nurses, but sometimes we just check the boxes when they come into clinic and we don't ask what, what their goals are. So yeah, I mean, walk door to door, find out what the needs are, randomly. You don't have to do everybody, but so that's what we did. We did a needs assessment, but then we also, had this contact with Centro Linguistico, and I would be surprised if someone in your university doesn't know someone in Jessica's Peru, or where do you want to go, Jessica Kastner? What country?
No, that's a great question. My interest is actually in interacting with sponsors and funders. And what you're saying resonates so deeply with me. In my PhD program, I went to University of Wisconsin-Milwaukee, and there were nurse managed health centers. And our dean would always say, you stumble across a nurse, they will find a way to help you. And this is what you're saying. But often funding is for a specified intervention, whether that's that household priority or not. So this matching of the true value of a nurse to go in and prioritize and assess and meet that family where they are in that community, versus often we're funding a specified intervention that may or may not have the reach. I would love to keep having those conversations about the value of the nurse and funding the nurse as the intervention, with going in there holistically and doing this process. So that's sort of my interest, is actually behind the scenes in what supports folks like you going to communities, what supports the public health nurse, how are we demonstrating that value, and how are those sort of incentives and structures aligned with what we know works best?
Well, I like that you're behind the scenes and you wonder about, funding, because funding is what, there are years where, without asking, I had $10,000 without writing a single, but just talking like to the Lions Club, the Kiwanis Club, and I will talk to anyone who will listen. And my church and other churches, and Liz knows every Beta Nu Sigma Theta Tau International Nursing, program that would have me, I was there. Someone's got to be the global health advocate. I didn't know I was going to, but I see now that that's why I was born. And I think that every place now, thank God, Liz is now going to take my place, because someday I'll retire. But I think we've got to do better advocating for what we do best. And I think that we can put together funding packages. I was told that I could put together a non-traditional funding package like nobody, but it's because, you're in the community and they trust you. And I've never gotten $1 million like Lisa Thompson from the NIH. I've written those grants, and I get really nice letters back that there's no funding for that. But
it's always a question of luck, actually. I really do. Yeah, I feel that way, that I was in the right place at the right time with the right idea. Otherwise I'd still be unfunded. But I think it's the idea of those water filters as I know a lot of people here at Emory that do water programs, wash programs. But I think that there's a real potential there for a big water filter scale up, especially in a place like Guatemala that has this company that's producing them like magic, and they're really good. Yeah. And I know somebody who knows the developer of the Ecofiltro, and I'm sure him or them, that it's a really they're so collaborative. And I think the idea of scaling up your pilot to a larger level, there's a new R01, well, it's due on July 26th, but it's non-communicable diseases and implementation science in tribal communities in the US or low-income countries. And it's, that's the kind of thing where, yeah, infectious disease and water, that's the key is, right, is what would be the non-communicable disease that would tie into water and infections. I don't know, but I don't know, maybe there would be something creative that could come up with that, like diarrhea causes stunting, and stunting is a chronic disease, and Guatemala has 60% stunting. And
Yeah.
would this water intervention reduce childhood stunting? That would be very interesting. So go write your R01. You can do it.
A doctoral student that just graduated, that I was her chair, and she did her dissertation in Guatemala with malnutrition. And so I'm going to give her the R01 idea. And she now has a postdoc at Arizona State University. So that's another legacy. We have to look for the people who are going to take our place.
That's right. Yeah.
Well,
Thank
you all. Thank you all.
Yeah, it's great to hear your work. Oh, you're muted. You're muted.
I just wanted to say thank you. And I love this organization. I'm so glad that Liz Mizell is an active member, and I'm very supportive.
Thank you very much. And to everybody else for attending. Bye-bye.
Good luck. Bye-bye. Thanks, Liz.